Hi everybody, it is week 13. We're so close to the end of the semester. Okay, so this week we're going to go through some general horse information, some first aid, some behavior, some things like that. So not necessarily things that are going to be you on your horse, but working with and around your horse. And I do think this stuff is quite important to know if you're planning on having horses or riding in the future. So the first thing we're going to go into is some horse behavior problems, or things that, how do you deal with if your horse does these certain things? There's a whole lot more involved than just they do these, but, going into just some basics of how you would handle them. So the first one is nipping and biting. You might have noticed there's several horses in the barn that have a tendency to do this, especially when you're tacking them up or brushing them. They don't really love being brushed. But this is not a good behavior. Ideally, you wouldn't want your horse to be nipping and biting at you. They usually learn this by being teased about food, or if you play with their lips or nose, it can encourage them to want to wiggle their nose at you, and then eventually can lead to biting. And then also feeding too many treats. So you might have noticed in class I don't allow anybody to bring treats or give horses any treats, and that's mainly because we have so many people working with our horses. We do not want to encourage our school horses that are around a lot of people, and we have young people that come into the barn to get the idea that they're always going to get treats, so that they're nipping at you or grabbing at your clothes or your hands, hoping that you have food in them. So one thing you can do is prevent them. To prevent it would be not giving a lot of treats. Try not to spoil them with treats. Sometimes occasionally a treat is a good thing here and there, but it's definitely not something that we should encourage to do all the time or in an excessive amount. And also, I would say it's not a good idea to play with their mouth. Horses' noses are pretty sensitive, and then you also then are just teaching them that they should be wiggling their nose and their lips, and then eventually that sometimes leads to their teeth. But some things you can do, be firm. Your horse needs to know that you're the boss. Remember, we've talked about multiple times that you have to be at the top of that pecking order. And so if they do nip or bite at you, you can slap the horse on their shoulder. It is not a good idea to hit them on their face. They can become head shy, or instead of associating the biting, then they got smacked. Instead, then they worry about that you're going to hit them and things like that, and it's not necessarily a good thing. A lot of them, if you just, growl at them or tell them no, they also understand a stern voice. The next one is kicking. Kicking is a normal behavior for your horse, and so that's something that you should think about. It's a defense mechanism for them. So when they're out in a herd, they are going to kick at each other, they're going to lift their leg at each other, and it's normal. However, if that is being done towards you, then it is not a good behavior, and it is something that we would want to put an end to. Most of the time, it's going to be if they feel threatened or frightened that they're going to kick. However, if they're threatening you, then they need to be disciplined. And I would recommend that this is done by someone that has a lot of experience around horses, knows how to discipline them without getting themselves hurt. Another behavior is bucking, but again, this is a normal herd behavior, and it's used to establish pecking order. So you do need to pay attention. Is your horse bucking because they're playing and they're exhibiting normal behaviors, or are they bucking because something is wrong? A lot of times they're going to buck when you're riding them, either out of discomfort, or something's painful, or they're just annoyed and irritated. And sometimes that is your fault, and sometimes it's something else that's causing it. When you first start a young horse, a lot of times they're going to buck, but it's not out of mean or spitefulness. It's uncomfortable to have a saddle on, to have a cinch that's tight around their belly, to have all that weight on their back. It's usually those things. And so those are things that they'll get over. It just takes some time. And then It could also be that they're feeling frisky and they're wanting to play. So trying to identify why is your horse bucking is important. Are they bucking because they want to play, or are they bucking because something is hurting them or uncomfortable? And before you really discipline and get onto a horse, you should always check your saddle, make sure it fits properly. If it doesn't fit properly, it could be causing pain in their back. You know, are they sore somewhere? Do they have back pain? Those kind of things. Check those first. If your horse just randomly decides to buck, and they're usually really good. Now, if you have a young horse and you're training them, they're probably not bucking necessarily out of pain, maybe out of discomfort because they're not used to it. And some things you can do is, the biggest thing is make sure their head comes up. A horse, if you look, when a horse bucks, they have to put their head down at least a little bit to get their hind end up off the ground. And so pulling their head up can help you keep their feet on the ground. So sit up back and tall. You don't want to lean forward. If you lean forward when they buck, you're going to probably fall off. So make sure you sit back, you pull their head up. And that's usually the biggest thing you do, and make them go forward, because it's really hard to be moving and have your butt up in the air. So head up, sit back, drive them forward, usually the best thing to do. However, then make sure you're checking for saddle fit and any kind of problems with their back. Next is shying or spooking. So this would be basically your horse. Some of our horses have done this in the arena. You may have noticed in some of our sections, especially when they go by the ramp. You know, if someone's walking down that ramp and they're making noise, or, you know, a trash can gets moved and put somewhere, they have a tendency to spook at it or shy, which means they kind of look and they move away. And usually they do this because things startle or scare them. One thing you want to make sure that you do not jerk on them in their mouth, like yank on them when they shy or spook, because then whatever was scary, then they're going to take and relate that to the jerking. And so then every time they see that scary trash can, they're going to think of pain because their mouth just got jerked on when that scary object was there. And so you want to make sure that you are staying calm. But again, so you don't want to like jerk on them to get onto them, but you also don't want to pet them and tell them, good boy, it's okay, because then you're just rewarding them for spooking, which a lot of times I know that's what we want to do, because we want to calm them down. So we're like, oh, it's okay, it's okay. You can talk to them, but you should not ever pet them after they've spooked, because then they just think, ooh, I spooked, and now you're going to pet me and say I'm a good boy, so I should do that every time. But so things you can do, I would say the most important thing is to keep them occupied and put them to work. You know, if they are busy having to think about their trot and moving forward, then they're gonna not have their mind on whatever was spooking them. So you want to turn their head slightly away from the object as they pass it, and then support them with your leg at the girth to encourage them to go forward. And then sometimes if they're really frightened, it is a good idea to just take them over and let them stand there and look at it. I wouldn't stand too close. They don't necessarily need to touch it, but look at it until they kind of calm down. And then encourage them to maybe, after they've stood there for a little bit, move up to it, sniff it, so that they're okay with it for the future. Another behavior problem would be running away or a hard stop. So a hard stop would just mean you're going around and they all of a sudden slam on the brakes and stop. Do not move. A real runaway is usually pretty dangerous if they do that, especially if you do not have any control. Especially because if your horse is really running away, they're panicking. And so they're not thinking, they're not paying attention to things, and that can be dangerous because they can run into things, they can get themselves and you hurt. However, I would say that 90% of the time they are not running away out of control. They're usually just like, ha, I'm going to get away with this, or something startled me, I'm going to take off for a little bit. But one thing, loping, galloping, it's actually pretty easy to sit to, especially once you've gotten more comfortable. And so the best thing to do is don't panic. Just sit through it. Sit up tall, sit deep in your saddle, shorten your reins, and then use a pulley rein. We've talked about that before. So you're going to take one rein pull them into a circle, because if they go into a circle, it's really hard to run fast in a tiny circle, and so that will help them slow down. And so you make the circle smaller and smaller until you force them into stopping. If you can keep yourself calm and you can steer, you can ride out most runaways and bring them back under control pretty easily. If your horse has a hard stop, one thing is your bit may be too mild, so you may need something a little stronger in their mouth, or it could be the opposite. It could be too severe, and so you're barely touching and they're wanting to stop. Or he may have been hurt by the bit, and so then he's just like, and like nervous about you touching his mouth at all. And a lot of times that is just going to require some retraining. Probably need someone professional to get on your horse and help get them through that process. Balking is a horse that stops or refuses to move. So when you feel the horse starting to hesitate, you want to send them directly forward. Reach forward with your hands, and this doesn't mean like to touch them. It just means you're holding the reins and you take and you move your arms forward so that you're no longer pulling, and that will help encourage them to go forward because there's no pressure on their mouth. So if I ever tell you put your hands forward, loosen your reins, it just means basically move your arms forward so you're not pulling on their mouth. Close your legs so you're encouraging them to go. You could even lean forward slightly in your saddle with your seat. I'm not saying like lean forward because that's not ever a good thing, but just slightly. And then one thing, if your horse really is stopped and stuck and they just don't want to go, whether you're on the ground or on your horse, if you turn them, a lot of times that can help unlock their feet and get them to start moving. And so then once they want to start moving forward, make them wait until the rider wants them to. So one thing you can do, if your horse just has a tendency to stop and not want to move, rather than make a big deal about it, just sit there. Just sit there and stand. Let your horse just stand there. Eventually your horse will get bored. No horse wants to stand still for 10 minutes. And so they're going to get bored. And then you want to just keep making them stand there even after they get bored. Even after they decide, oh, actually, I would like to move. Then you want to make them stand until it's your idea and you allow them to move forward. A lot of times that can help fix that problem pretty quick because they're like, oh, well, this is worse just standing here. And so you kind of have to use a little bit of reverse psychology sometimes on our horses to get them to go, oh, well, this is worse. Let's just go. A lot of times horses that become barn sour will sometimes balk when they're going away from the barn or away from the gate. So in our case, the gate where we enter in the arena, sometimes horses will have a tendency to get to where they want to stop right there and not move, which is part of why we always get off in the middle of the arena. We don't get off by that gate because we want to try and limit that as much as possible. But, again, sometimes these kind of behaviors are going to need a more advanced rider to get on and help fix the problems. Out of all these behaviors, rearing is probably the worst. It's probably the most dangerous for a rider because a horse, if they are out of control and not paying attention when they rear, they can potentially fall over backwards, which is really dangerous. I would say most horses, this is not their first instinct. Most horses, out of discomfort and those things, are going to buck or run away or shy, those kind of things, or spook at things many more times before they'll ever rear. There are some horses that are a little lighter on their front end that they have a tendency to rear as their bad behavior, but I would say usually it's not the first instinct. It is a difficult behavior to cure. But it is something that it does happen. A lot of times when we're teaching our horses collection, which we haven't really talked about in class, but collection requires our horses to really stretch up underneath themselves, lift their backs, and give with their face so they get like a nice round body. And they have more control. They're able to do a lot more higher advanced maneuvers, a horse that is collected versus ones that are not. And so but when you do this, you do apply pressure to their mouth. And so a lot of horses, when you're teaching them collection, they get frustrated because they don't quite understand what you're wanting. and it's hard work to collect. And so they have, a lot of times they'll rear a little bit. But if they're just rearing just a tiny bit, you know, they're probably not doing it to be mean or hateful. It's just more out of like, I don't understand what you're wanting. And so, you know, if your horse does small little rears, or they're not doing it out of hatefulness, just lack of understanding, things that you can do to help keep them from ever learning to really rear is to lean forward, hold on the mane of their neck as they're coming down, and try and make them go forward. Because again, similar to bucking, they can't have their front end up in the air if they're moving forward. So getting them to go forward will help get their feet back on the ground, and also encourage them not to do that. And a lot of time, a pretty severe bit is going to cause a horse to potentially rear, because that pressure in their mouth is going to make them a little bit like this. And then when they get where they're pulling back, then they have a tendency to rear. So, you know, if your horse starts doing it, it's definitely something to check, especially if it's they're rearing when you're touching their face or pulling on the reins, then potentially, you know, it's a bit problem. Weaving is usually a behavior they do in their stall. They do this. They basically like weave back and forth, and they usually do it in their doorway. A lot of race horses do this out of boredom, because they're in stalls a lot between the races and riding, and they're also high energy horses, so it's usually a pretty common behavior with race horses. A lot of times, you know, sometimes it can be a pretty bad behavior. They may weave to an extent that they don't eat and those kind of things. But, you know, giving a horse more long stem roughage, some grass to eat, turning them out more so they get more turnout time to play, or a companion animal. So a lot of racehorses have goats that live with them. Those kind of things can sometimes help a horse that is real nervous in their stall, and keep them from being quite so bored. Some more problems would be cribbing. So some of you have seen like DT and Sparky, Dandy, I think Beamer, they all wear a cribbing strap or collar, and it's because they crib. And so what this is you can see in this top picture of a horse, they bite down on a post. So you can see here, they bite down on a post, they suck in air, they arch their neck, suck in air, and they usually kind of make like a grunting, burping type noise. And the reason horses do this is because it releases endorphins, and so they become addicted to it. So it's similar to a person that like bites their fingernails or picks at their fingernails. They eventually build up like this habit, and become addicted to it. And horses also become addicted to cribbing. You know, if a horse does it too much, it can potentially lead to digestion issues, because if they do this instead of eating, it can be a problem. Also, it wears off their teeth, especially their top front teeth. And so instead of being able to use those teeth to bite off feed, it's going to wear their teeth. But some things you can do is put a cribbing strap on. So that's this bottom picture, because it is going to press into their throat, and it makes it hard for them to swallow air. So it's just like if you were to take and gulp some air, if someone's pushing on your throat when you go to do that, it's going to be hard to swallow. And so that is, you know, why that happens. But I would say horses, it doesn't stop them. It is not a cure. It's not going to make them quit. It just may make them crib less. So here is a little video on some cribbing behavior.
Why do they do it, and how can you stop it? In this week's Your Horse's Health, Dr. Kenton Morgan takes a look at what can be a frustrating problem for horse owners.
One of the most common vices or bad habits that your favorite horse can pick up is one that we call cribbing. A cribber is the term we use to describe a horse which will grasp an object with its upper front teeth, arch its neck, and pull backward. And in some horses, this will also include swallowing air at the same time. We are not sure what causes some horses to take up this behavior, but it is likely that horses which become bored, have little opportunity for physical activity, and have restricted feeding times are at higher risk to pick up this bad habit. Horses that are out on pasture are less likely to develop this problem. It is also interesting to note that some horses will pick up this behavior by watching other horses that do crib. Besides the obvious damage to barns and fences, this behavior can pose health risks to your horse. The horse can wear down the incisors, making it difficult to graze. A recent study has also demonstrated a possible association between cribbing and a small intestine problem, which when it occurs, requires corrective abdominal surgery. It is very difficult to stop this behavior if it has gone on for an extended period of time. Cribbing collars, muzzles, and even neck surgery are used to correct this problem, but in horses where this has gone on for a long time, none of these treatments may be completely effective. Prevention is the real key when it comes to cribbing. Keep your horse out on pasture or in a paddock if possible. If you must keep your horse stalled, be sure it gets plenty of exercise. And if grazing is not an option, having hay available most, if not all of the time, will give the horse something to do and help discourage cribbing. If you notice your horse is beginning to crib, take action immediately. Catching it early offers the best chance for success. You may need to fit the horse with a cribbing collar, but also be sure to change the environment. Get the horse outside more, preferably in an area where it can graze. Increase the amount of exercise the horse is getting, and even interacting with other horses may also be beneficial. Anything that increases the activity level and occupies the attention of your horse will help. If you suspect your horse is beginning to crib, contact your veterinarian. He or she is the best person to provide information to you on how to treat this problem. I'm Dr. Kenton Morgan, and remember, always keep your horse's health first.
So hopefully that gave you a good idea of kind of some things you can do to help if you have a horse that cribs. The next one is wood chewing, which is very similar to cribbing, except for they're not sucking in air, they're just chewing. It could be a lack of salt or minerals in their diet. There's been studies that say that a lot of times it's just boredom. And especially if you feed like 2 meals a day, your horse gets bored, and if they're inside and they only get 2 meals a day, they're bored, they don't have food to eat because they've already ate it all, so they start chewing on wood. But they do make a lot of products on the market that you can paint on the wood to keep them from chewing. Horses aren't a big fan of spicy flavors or vinegar, and so those two kinds of things you can paint on. So like buying vinegar, buying like jalapenos and then grinding them up and painting them on, those can also be really good. They just don't last as long as some of the store-bought products that are on the market. So next we're going to talk about some hoof care, so that you understand that it is a very important part of owning a horse or riding, is that they need daily hoof and feet care. Because I would say most horse lamenesses start in a horse's legs. So it's really important that we think about this. So that is why you need to pick out your horse's feet and clean them out before and after riding every day. So daily attention. Then you need to also keep up with trimming or shoeing your horses. So it depends on how much work and exercise your horse is doing to determine whether or not they need to have actual shoes on. But either way, they need to have their feet trimmed or reshod. So that's putting new shoes on every 6 to 8 weeks for most horses. I would say, depending on how much your horses are worked on, whether you can go 6 to 8 weeks. I would say if you're riding your horse on a regular basis, then 6 weeks is pretty common. If it's more of a pleasure type horse, you ride them just occasionally, maybe once a week, something like that, then maybe every 8 weeks. But also depends on your horse, because some horses' feet grow faster than others. So the average growth is about 3/8 of an inch per month. But again, that's an average, so some horses are going to grow more, some are going to grow less. So if a horse is worked on hard surface, or they don't have very good strong feet, and their feet wear down and then they get tender, then potentially they are a good candidate for shoes. Also, if you're showing or riding on lots of different types of surfaces, sometimes you need shoes to help with that. Or if you ride out on gravel, those kind of things, you might want shoes to help protect the bottom of their foot, keep them up off the gravel. And then if feet problems is another reason to have different types of shoes on. It can help with different lameness issues. You can help fix some of those, some conformation issues. So sometimes shoes are going to be necessary. So lameness is something that means pain in a horse's leg or foot. So similar to like colic is any kind of digestive upset. Lameness is any type of pain in their leg or foot. One thing to make sure you realize, horses don't know how to fake lameness. They can't just be like, I don't want to work today, so I'm going to limp so that you don't ride me. So don't ever think that. They can't fake it. However, it may come and go. Some lamenesses are caused by injuries. Some are from riding on rough ground. Some could be incorrect shoeing if you don't have a very good farrier. Or just sometimes they, get a nail that gets a little too deep or things like that. It could be illness. And then arthritis is probably one of the most common reasons for lameness, especially in our older horses. It's usually easiest to identify a horse is lame or limping at a trot. Whereas the walk is pretty smooth, the lope canter is pretty smooth, and a lot harder to identify lameness unless they're really lame. But if you notice your horse is limping or has showing some lameness, you want to check their feet for foreign objects, cuts, or swelling, because then you can identify maybe that's the cause. Clean feet, wash it with water. A nail or a stone stuck in their frog or sole of their foot. Sometimes just picking it, you can't see it, especially if it's the color or how deep it's down in there. So if you want to pick them, really clean them out good, rinse them off. And then some things when you're watching a horse to identify lameness, if it is in their front leg, they will lift their head up as the sore leg hits the ground, and they drop their head when the good leg hits. So lift the head as the sore leg is touching the ground, drop it when the good leg hits the ground. So one thing you can tell a horse is lame or limping is they're going to be bobbing their head when they're trotting. If their hind leg is in pain, they may hitch a hip higher on the lame side. So instead of looking smooth, they're going to kind of be trotting with one hip a little higher than the other because they're not going to be pushing all the way down with every step. And then they may also drop their head lower to pull more weight to their shoulders. And then one thing on front leg or a back leg, they may take a shorter step with their sore leg. So some common reasons for lameness. And I'm not going to go into too much detail. If you take other classes later on, you can get more detail. If you've already taken some other more advanced classes, you can get more details. But laminitis is inflammation of the sensitive laminae. So the laminae is basically between the hoof wall and their coffin bone. And so it's what holds their coffin bone to their hoof wall and keeps it in the correct spot and from rotating. But if they have laminitis, it does require some aggressive treatment from a vet. And then there's some shoeing things you can do to help. And so you can see this top picture. You can see here like the coffin bone of a normal foot. And then acute stage, so they're just starting to have some laminitis, which is some separation of that laminae from the coffin bone from the hoof wall, and then it starts to rotate. You can see here there's some rotation, and then if it gets really severe, they can have rotation where the coffin bone actually pokes through the sole of their hoof. I would say that's pretty severe. It has to get to a pretty bad stage, and you are not doing any treatment or care to keep that from happening. Navicular is progressive degeneration of the navicular bone. So this is the navicular bone right here. And so this deep digital flexor tendon kind of wraps around it. And what happens is it gets like rough, sharp points on it, potentially when it starts to degenerate. And so it rubs on that tendon and can cause some major pain. And there is no cure for navicular, but you can do some corrective shoeing. Usually they put in a wedge shoe. So a shoe that instead of having their nice and flat like this is going to lift their heel a little bit, which then will help straighten that tendon a little bit. so it causes it not to rub so much on the navicular bone. So that's some things they can do initially to help with, and then also just pain medication. A hoof abscess, so here's a picture down here. It's usually an infection that gets inside the hoof, through the hoof wall, and so it'll break through. A lot of times they break through at the sole, or they break through up at the hairline at the top, so like up here at their coronet band, that infection will break through and come out. Usually they're really lame when they have an abscess, and they'll have a lot of heat in their foot, and you usually can feel their pulse back here during that time. Arthritis is just chronic degenerative condition, inflammation of the joint. Usually older horses are going to start to get it, but they can get inflammation in any of these joints that cause arthritis. And then a pulled tendon, injured to one of the soft tissue structures of the leg, and usually there's not much you can do about that but time. Thrush is another one thing to look at. It's an infection that usually is found right along the frog. And the easiest way to identify it is their feet are going to stink, and they're going to have a wet black discharge that's usually down in here in the frog, and it smells really bad. It's usually a bacterial or fungal infection that gets down in here, and so the biggest thing is keep their stalls clean, make sure that you really clean this area out in order to help prevent. Another one would be scratches or mud cracks. You can see here in this picture. It's usually from moisture in the soil, and they get like a bacterial infection, fungal infection that causes them to get scabs, and then that fungus gets in there and it causes sores. And so the biggest thing is you got to keep them dry, clean, and then put a protective ointment. So a lot of times like a diaper rash cream that you would use for a child works really well for keeping on here, because it'll keep out the water, moisturize it, help get rid of it. So some first aid things to think about. You know, you should have a first aid kit or have the items that would be in a first aid kit. I would say here, you know, we don't necessarily have like a kit that we call a first aid kit, but we definitely have all of these items. So if your horse gets hurt, especially severely, the first thing you should do probably is contact a professional. So that would be a veterinarian, a trainer, someone that knows what they're doing that can help you assess the problem. You want to stay calm, and then make sure that you have a first aid kit so you can fix things. Some things to think about is horses have a lot of blood compared to what we have. So they can bleed a lot before anything major is going to happen. So if you do see blood, don't panic. They can bleed a lot before it's a major problem. However, you would still want to try and stop the bleeding. So some good items to have in your first aid kit would be your vet's name and phone number, so that you can get a hold of them easily, quickly, have that written down somewhere in your barn so it's an easy, accessible thing. A flashlight, stethoscope. If you have one, it's a really good idea, because then you can get your horse's heart rate and know if they're under any kind of stress. Some curved scissors so you can cut bandage material and those kind of things. Tweezers. If they get something stuck somewhere, tweezers are always a good idea. Hoof pick, sterile syringes for flushing, some type of saline solution, an antiseptic scrub, so something to scrub a cut or something really clean, and then an ointment to put on it, and then some type of adhesive bandaging. So some things you can do to help if your horse has some kind of wound. So if it's just a if it's just a minor wound, so nicks, cuts, scrapes, they probably are not going to require you to call the vet. So like you can see here in this picture, this is pretty minor. You're probably not going to call a vet for this. But some important things is make sure you clean it really well. You want to run water over it, especially if it's bleeding a lot. You might run water over it, or if it's got a nice scab on it, so you can help get that scab off, so you can make sure it's nice and clean. A scab isn't a bad thing if it's been cleaned. However, if they get a scab over a dirty wound, potentially that's holding in an infection. So making sure it's nice and clean, use a mild ointment. If it's something that's going to be cleaned and medicated regularly, it's a good idea to shave the hair right around it, because hair getting inside a wound can cause infection, because it can bring in bacteria and those kind of things. And then if it's a bad enough wound, you may need to bandage their lower legs. However, you do need to know how to do this correctly. If you're not doing it correctly, it can actually cause more harm than good. And then also, whatever you do to one leg, you want to make sure you do the same thing on the other leg, even if they don't have a wound. So if you have a front leg injury, you would want to wrap both front legs, or back legs, wrap both back legs. A puncture wound, it's probably one of the most dangerous and things you should really want to make sure you take care of it and manage it properly. And part of that is because if it's a puncture, it has a deep inside hole, and they can get bacteria up in there, and then they get a nice scab over this, just like I was talking about. They get a scab over the top of that, and then that infection is gonna stay in there, and instead of it healing, it can get a lot worse. And then also they could potentially get tetanus from that. So if they have a puncture, they may need to get a tetanus booster. But again, that's a reason you want to make sure your horse gets a tetanus shot yearly. But you want to make sure if it is a puncture wound, that it is not allowed to scab over, because it needs to heal actually from the inside out. So you want to keep that scab off. You want to make sure you keep it really clean so that it can do that. Then if you have a really serious wound, the biggest thing is control bleeding first with pressure. So take some kind of gauze, bandage, something, apply pressure, hold it on there until it stops bleeding. And then you want to try and keep your horse quiet and calm until the vet arrives. So whatever that may need to do that, you need to. One important thing to think about is if your horse does need stitches. So if it's a bad wound that it's going to need stitched up, it needs to be done immediately. After about 24 hours, no vet is going to want to stitch it, because then there's a high likelihood that you're going to be stitching in bacteria or an infection, which then can make things worse in the long run. And so if you think it's going to need sutures or stitches, make sure you don't clean it with any kind of soap or ointment. Wait till the vet gets there. Use only water. Let them do the cleaning. So now that's kind of your first aid, some management, some care, behavior. Next, we're going to go into talking about selecting a good horse. So if you are thinking after this class, like, I really want to have a horse someday, well, it's ideal that you pick a horse that is appropriate for you and your level of training. So suitability is finding the appropriate horse. So it needs to fit the job that you want it to do. Do you want to go out on trail rides? Do you want to show? Do you just want to ride it around in your pasture every once in a while? All those things. Make sure you get a horse that's appropriate for that. Also, if you want one that's very specialized for a discipline, and then it fits you as a rider. If you're a really tall person, getting a tiny little pony is probably not going to be ideal. Your horse is going to struggle with carrying the weight. Or, if you're a tiny little person, you may not also want a big giant horse either. And then the temperament is suitable to you. So if you are a timid rider or a beginner, I would recommend that you get an older horse that is calm, so that you're not going to be scared in any way, because that's the quickest way to want to quit riding, is if you get scared. Or if you're an advanced rider, you may want a younger horse that knows less. So there are three kind of main types of horses to look at. So there's stock horses, saddle horses, and hunter types. So stock horses are going to be like our quarter horses. They're going to be used pretty regularly for like trail rides or pleasure riding, so out in a pasture just for fun, or some of our Western type show events. A saddle horse would be, there's saddle type classes that have different types of movement. It's a pleasant horse to ride. I would say it's kind of a specific kind. And then our hunter types are going to be our horses that jump or do dressage. They're going to be a little bit lighter. They're going to carry their heads a little higher. So here's some just pictures, examples. Our jumping hunter type horses, more of our stock type horses. So another thing to think about when you're buying a horse, so suitability, does it fit what you want to do? And then also looking at its conformation, how is it built? So the way the horse is put together. Defects can make the horse have lameness issues later on. You know, if your horse isn't built that well, there's potential that you're going to have issues with keeping them sound. So yes, everybody wants a pretty horse, but make sure your pretty horse also is built correctly. And especially their feet and legs are important, because if they have lameness in their feet, then you're not going to be able to ride them. So when you're looking at a horse, you want to look at them from a distance, get an overall picture, and then do a close inspection, look at them up close, and see everything. So here's some things to look at. Do they have nice straight legs? So ideally, they should have a nice straight line that runs down through their front leg, through their knee, down through their cannon, fetlock, and pastern. So nice and straight through here. Here's a horse that toes out or toes in, so their toes are pointed in, and those would be conformation defects, and it's going to cause them when they're moving to either wing in or wing out. So that's the front legs. The hind legs, again, nice straight line down through the hock, cannon, fetlock, pastern. They can have cow hocks where their hocks are close together, toes out, or here where their hocks are bowed the opposite direction and their toes are in. And those can all lead to lameness problems later in life. So here's a horse that has some good conformation, nice slope to the shoulder, deep chest, and then here's one that's kind of got a steep shoulder, maybe a long back, you know, a really pointy croup. Those are all things to look at. Next thing is thinking about the differences between an unsoundness and a blemish. So an unsoundness is a serious condition that affects the horse's usefulness. So an unsoundness, they're probably going to have some lameness related to that unsoundness. Whereas a blemish is usually a defect that hurts their appearance but not their ability to work. So if they have a big scar, that would potentially be a blemish. So it's ugly and unsightly, but it's not causing them any lameness. So an unsoundness examples would be a bowed-tended, contracted heel, fistula, gravel, which is an infection beneath the white line, or ring bone. Whereas a blemish could be just they have a big knee, so they have some swelling, or a capped hock where they have swelling in their hock, capped elbow, swelling in their elbow, or a wind puff is swelling down near their cannon bones. And those are just, they don't look the best, but they're not going to cause them any lameness. So here's some pictures of some different blemishes and that they could have. So they're unsightly, but they're not necessarily causing lameness. They could potentially, some of them, but not necessarily. So hopefully this gave you a good idea of some behavioral problems that horses can have, some first aid things to think about, how you might think about choosing your own horse if you're going to get one, choosing one for the correct purposes, and then looking at, do they have unsoundnesses that are going to cause it to where you can't ride them later on, or is it just an unsightly blemish? So again, remember, take the quiz by Friday.